module Overview to empower you with the advanced skill of customizing their CVs to suit specific healthcare roles, job descriptions, and work environments. This module helps healthcare job seekers create targeted, role-sensitive CVs that directly match employer needs and significantly increase interview chances, both locally and internationally. The danger of a generic CV in healthcare. In healthcare recruitment, a generic one-size-fits-all CV is a red flag to recruiters. Every role has distinct expectations in skills required, certifications preferred, type of experience valued, soft skill profile, legal, regulatory compliance. A successful CV must show direct alignment with the job description and the mission of the hiring institution. Example: a CV for a community health worker will look very different from a CV for an ICU nurse or a clinical researcher. CV customization by healthcare role. Below are role-specific customizations. A. Nurse, general practice, ICU, theater nurse, etc. Emphasize clinical procedures. IV insertion, triage, dressing wounds, patient monitoring, include special unit experience, ICU, maternity, pediatric, etc. Highlight CPR, BLS, ACLS certifications. Mention shift flexibility, emotional resilience, teamwork. B. Doctor, house officer, registrar consultant. Include rotations and departments covered. Specify number of patients handled per shift. Showcase procedures performed, e.g., suturing, intubation, lumbar puncture. Mention clinical audits, morbidity reviews, and continuous medical education, CMEC. Pharmacists mention types of pharmacy, hospital, retail, community, industrial showcase. Familiarity with medication management systems, stock control, pharmacovigilance. Highlight regulatory compliance, e.g., PCN license, NAFDAC knowledge. D. Laboratory scientist. List tests performed, hematology, microbiology, serology, etc. Mention lab machines and technologies used, e.g., ELISA, centrifuge. Emphasize precision, SOP compliance, and infection control, E. Physiotherapist. Highlight treatment plans developed. Include patient conditions treated, musculoskeletal, neurological, sports injuries. Mention therapy methods, hydrotherapy, electrotherapy, manual therapy. F. Health assistant or community health worker. Emphasize outreach and preventive care. Highlight health education, record keeping, and referrals. Note familiarity with local language and culture, especially in rural roles. CV customization by work setting. A. Hospital CVS emphasize high-pressure competence, patient volumes, emergency response. Include familiarity with equipment, procedures, patient documentation. Mention shift systems, SOP compliance, teamwork with multidisciplinary teams. B. NGO/International Health Agency, CVS, emphasize cultural adaptability, cross-border health knowledge, show experience working in low-resource or humanitarian settings. Highlight public health campaigns, research, or mobile clinics. C. Telemedicine or tech-based health services, emphasize digital literacy and telehealth software, e.g. EMR, virtual consultations. Mention strong written/spoken communication, documentation, remote diagnosis. Highlight data privacy compliance. Keywords and terminology tailoring. Each job has keywords embedded in the job description. Your CV must mirror these terms. Example: if a job description says, must be skilled in patient triage, emergency stabilization, and CPR delivery, then include performed emergency triage and CPR during accident response at XYZ hospital. Use industry language, infection control versus cleaning skills, patient-centered care versus caring for people, multidisciplinary collaboration versus I worked with doctors, customizing career summaries. Your professional summary must be tweaked for every application to match the specific job title, the facility type, the geographical or cultural context, urban versus rural, international versus local. Example for international nursing role. Globally trained nurse with 4 years experience in trauma care and patient monitoring. compliant with World Health Organization protocols and licensed by the Nursing and Midwifery Council of Nigeria. Actively seeking placement in global emergency care facilities with strong ethical standards. Accreditation and compliance integration. This module reflects standards and best practices from JobScan CV customization tools, World Health Organization, WHO, competency mapping, NHS trusts, role-based hiring templates, UK, UN, and Red Cross humanitarian healthcare job competency models, AHPRA, role alignment standards, Australia, Canadian immigration pathway, express entry, healthcare stream, tools to help you customize, jobscan.co, scan job ads and compare them with your CV, Grammarly, for tone and professionalism, Canva Resume Builder, template-based customization LinkedIn, job descriptions, learn what international employers emphasize, Resume Worded and Resi.ai, AI-based tailoring tools. Key takeaways. Tailoring your CV is non-negotiable in healthcare. Understand your specific role and job environment. Use the employer's terminology, highlight experience, licenses, and impact aligned with the job description. Adapt your CV layout and tone for local versus international applications.